In this lecture, we will discuss infection control and prevention. Infection is the invasion of body tissue by microorganisms with the potential to cause illness or disease. The human body is continually threatened by foreign substances, infectious agents, and abnormal cells. Nurses must think about infection prevention all of the time. They know that if they move from patient room to patient room with contaminated hands or equipment, they risk infecting everyone they touch. The effectiveness of other care provided does not matter if nurses are not protecting their patients against infection. Therefore, nurses are always directly involved in providing a biologically safe environment. Infection control is central to delivering high-quality nursing care. Microorganisms exist everywhere, in the water, in the soil, and on body surfaces such as the skin, intestinal tract, and other areas that are open to the environment. Examples of these areas include the mouth, the upper respiratory tract, the vagina, and the lower urinary tract. Poor hygiene behaviors facilitate transmission of infectious diseases, especially in childcare settings and other environments that include hospitals, clinics, and healthcare provider offices. All skills and treatments, whether administering medications or preparing patients for discharge, are performed in a manner that prevent possible infection of patients. Some nursing skills are specific to preventing infection, recognizing signs and symptoms of infection, and treating patients who are diagnosed with an infection. Nursing skills used in preventing infection and caring for patients diagnosed with infection include hand hygiene, basic medical asepsis, the use of standard precautions, isolation techniques, sterile fields, and the use of PPE and decontamination. Healthcare-associated infections, which are commonly known as HAIs, are classified as infections that are associated with the delivery of healthcare services in a facility such as a hospital or a nursing home. HAIs add hospital days, reduce admissions by occupying available beds, and increase the cost of healthcare. HAIs can either develop during a patient's stay in a facility or manifest after discharge. They typically manifest after 48 hours of hospitalization. Infections that manifest during the first 48 hours of hospitalization are considered to be acquired in the community. A urinary tract infection, or UTI, is the most common type of HAI and the most frequent cause of gram-negative specimens in hospitalized patients. Surgical site infections and pneumonia are other types of HAIs that round out the top three. By using precautions with general medical asepsis, appropriately using PPE or personal protective equipment such as gloves, masks, respirators, gowns, goggles, and special resuscitative equipment, and the vigilance in the clinical area will place the nurse at significantly less risk for infection. Prevention remains the primary goal. The chain of infection consists of 6 links: the infectious agent or the microorganism, the place where the organism naturally resides or the reservoir, a portal of exit from the reservoir, a method or mode of transmission, a portal of entry into a susceptible host, and a susceptible host. When we talk about the infectious agent, we need to discuss the infectious process, which is going to depend on the number of microorganisms that are present and the virulence or the potential for causing harm within the microorganism. When we discuss reservoirs, these are going to be the sources of the microorganism. Common sources are other humans, the patient's own microorganisms, plants, animals, and the general environment. A carrier is a human or an animal reservoir of a specific infectious agent that usually does not manifest any clinical signs of the disease. Before an infection can establish itself into a host, the microorganism must leave the reservoir. Common human reservoirs and their portals of exit include the respiratory tract, the gastrointestinal tract, the urinary tract, the reproductive tract, blood, and tissue. When we discuss the method or the mode of transmission, we can discuss three modes. Direct transmission, which involves the immediate and direct transfer of the microorganism from one individual to another through touching, biting, kissing, or sexual intercourse. Indirect transmission, which can be either vehicle-borne or vector-borne, and then airborne transmission, which involves droplets or dust. The portal of entry is when an individual becomes infected, the microorganism has to enter the body. The skin is a barrier to most infectious agents. However, if the person has any sort of break in their skin, that can readily serve as a portal of entry. Cuts and tears in the skin also provide portals through that the microorganism can enter and cause disease. A susceptible host is any individual who is at risk of infection. Infants and young children are often susceptible hosts. Their immune system has not fully matured, and they have not yet developed antibodies to many of these infectious agents. A compromised host is an individual at increased risk for one or more reasons, and they are more likely to acquire an infection. Examples are somebody who is either very young or very old, someone who is receiving immunosuppression treatment for cancer or a chronic illness, and somebody who has immunodeficiency conditions. Let's discuss the nursing interventions that can be performed at each link to help break the chain of infection. When we're discussing the reservoir, we need to make sure that we are changing any sort of bandages to include surgical dressings or any other dressings that the patient may have, that we're using proper facility protocol in the disposal of any linens, making sure that we are maintaining standard precautions when we're handling any bodily fluids, and then properly disposing of any suction or drainage containers or bottles. When we talk about the portal of exit, we want to make sure that when we're talking, we're coughing, and we're sneezing, making sure that we're not using proper etiquette so that we're not contaminating the patient's room or the environment. We're also not performing these over any sterile fields or any wounds, because that would be a way to exit our body and enter a susceptible host. When we're talking about the transmission, we want to make sure that we're always following our hand hygiene and washing our hands, whether we're using the antibacterial foam or we're using good old-fashioned soap and water. We want to make sure that we're teaching our patients and their visitors about proper hand hygiene, making sure that they're aware of the proper use of PPE if they're on isolation precautions. Make sure that the soiled linen is disposed of properly. Any bedpans or any urinals are handled using aseptic techniques. We're also using aseptic precautions and cleaning our equipment. So especially your stethoscope or any equipment that you're taking from patient room to room, such as the Dynamap or Vital Signs machine, all of those should be cleaned using whatever your agency has designated as proper aseptic technique. When we discuss portal of entry, we want to make sure that if we are performing any procedure to the patient, we are using aseptic or sterile technique. We're properly disposing of any sort of needles that are used, so making sure that you're putting them into the sharps container, and that we're providing any personal hygiene products to our patients so that they can perform hygiene practices while they're under our care. As far as the susceptible host, we want to make sure that we are maintaining skin integrity. So the proper hygiene techniques would be a way to maintain skin integrity. If the patient has any sort of skin that's not intact, making sure that we are providing barrier cream or providing dressings that would cover the skin, making sure that the patient has proper nutrition, and then educating the patient on health promotion such as immunization, so that they can prevent themselves from encountering any of these infectious microorganisms. So individuals normally have natural defenses that help protect the body from infection. Intact skin and mucous membranes are the body's first line of defense against invading microorganisms. Unless the skin and mucosa become cracked or broken, they can act as effective barriers against the bacteria. Fungi can live on the skin, but they cannot penetrate it. The dryness of the skin is also a deterrent to bacteria. Bacteria grows most plentiful in moist areas of the body, such as the perineum and the axilla. Resident bacteria of the skin also prevents other bacteria from multiplying. The resident bacteria use up the available nutrients, and the end products of their metabolism inhibit other bacterial growth. Normal secretions make the skin slightly acidic and thus also inhibit bacterial growth. The nasal passages have a defense function. As entering air follows the route of the nasal passages, it comes in contact with moist mucous membranes and cilia. These structures trap microorganisms, dust, and foreign materials. The lungs have alveolar macrophages, which ingest the microorganisms and other cells and foreign particles. Each body orifice also has protective mechanisms. The oral cavity regularly sheds its mucosal epithelium to rid the mouth of any sort of bacteria that could colonize. The flow of saliva and its partially buffering action can help prevent infections. Saliva contains microbial inhibitors that can also protect the mucous membranes from becoming infected. The eye is protected by tears, which continually wash the microorganisms away, and they also contain a lysoenzyme. The urine flow is believed to have flushing and enzymatic action that keeps the bacteria from ascending up into the urethra. An intact mucosal surface also acts as a barrier. Lastly, the GI tract has defenses against infection. It's a highly acidic environment in the stomach, and that normally prevents any sort of bacterial growth. The resident flora of the large intestines helps to prevent the establishment of disease-producing microorganisms. Peristalsis also tends to move the microbes out of the body. The Hospital Infection Control Practices Advisory Committee of the CDC presented updated guidelines for isolation precautions in 2015. These guidelines designated 2 tiers of precautions. Number 1, standard precautions, and number 2, transmission-based precautions. Standard precautions are used in the care of all hospitalized individuals, regardless of their diagnosis or possible infection status. Transmission-based precautions are used in addition to standard precautions for patients with known or suspected infections that are spread by contact or by airborne or droplet transmission. The 3 types of transmission-based precautions may be used alone or in combination, but always in addition to standard precautions. They encompass all of the conditions or diseases previously listed in the category-specific or disease-specific classifications that were developed by the CDC in 1983. So with standard precautions, we're always going to follow these precautions for any patient. So number 1, you want to make sure that you're performing hand hygiene before and after every patient contact. You want to make sure that you're using the personal protective equipment when in risk of exposure to bodily fluids. You're going to use sharps containers to dispose of any used needles. We're going to perform routine environmental cleaning, and that is going to be dependent on your facility's policy of what products they recommend for the cleaning process. You're going to make sure that you clean any shared patient equipment. So like we talked about, your stethoscope, the Dynamap, the Accu-Check machine, any equipment that you're taking from room to room with your patients. You want to make sure that you're following respiratory hygiene and cough etiquette, that we're using aseptic technique, and that you're handling and disposing of waste and linen safely. All of these will be according to your facility's protocol. The initiation of practices to prevent the transmission of microorganisms is generally a nursing responsibility. It is based on a comprehensive assessment of the patient. This assessment takes into account the status of the patient's normal defense mechanisms, the patient's ability to implement necessary precautions, and the source and the mode of transmission of the infectious agent. Nurses decide whether to wear gloves, gowns, masks, and protective eyewear. In all patient situations, nurses must first cleanse their hands using proper hand hygiene before and after providing care. So in addition to using the standard precautions we discussed, now we can implement isolation or transmission-based precautions. We have several different types that can be initiated. Contact isolation is going to be for serious and easily transmitted infections, and that includes our patients with C. diff, VRE, and MRSA. Droplet precautions are going to be used in situations where the patients maybe have influenza or mumps. These are going to be droplets that are spread that are larger than 5 microns and can be spread in a distance of 3 feet. And then lastly, airborne precautions. These are going to be for organisms such as tuberculosis that can spread throughout the air. We are going to use a respirator or an N95 mask, and that patient will be put into a private room with a negative pressure. On this slide, these are examples of the signs that must be put on the patient's door or right outside of the door so that anyone entering the room must wear whatever PPE is required. So when we have a patient with airborne precautions, they are going to be known to have a serious illness that's transmitted by airborne droplets that are normally smaller than 5 microns. So most of the time, these are going to be our patients who are exhibiting signs and symptoms of tuberculosis. For our patients with droplets, these are going to be patients who have illnesses such as pneumonia. They can have pertussis, mumps, influenza, and rubella. And then, like we talked about, the contact precautions, these are going to be for our patients who have GI, respiratory, skin infections that are going to colonize with the multi-drug resistant bacteria or MRSA. So we can also use these in our patients with C. diff and VRE. The last precaution to discuss is neutropenic precautions. These precautions are used for patients who are immunocompromised or have a low white blood cell count because they are more susceptible when they come in contact with infectious organisms to acquire an infection. So in addition to using standard precautions, we must also make sure that we're using proper hygiene when we're entering and leaving the room. With this type of patient, we don't want to allow anything into the room that could carry bacteria. So a lot of the times you're not allowed to have flowers, fresh fruits, or vegetables. A lot of times we're wearing gowns and gloves when we're entering the room so that we're not transmitting anything to the patient. We also must make sure that we're using patient-dedicated or disposable equipment so that the equipment is not transferring from patient room to room, that they have a set of equipment that's just for their room. When this patient is being transported in the hall, if they have to go for a procedure, we must make sure that they're wearing a mask to protect them from the environment that they would be exposed to during the transmission. In all patient situations, nurses must cleanse their hands before and after providing care. Contaminated hands of healthcare workers are the primary source of the spread of healthcare acquired infections. Hand hygiene is required upon entry and exit of the room. The nurse must perform it immediately after removing any PPE and then in between patient contacts. The nurse must wash their hands thoroughly with soap and water or an alcohol-based rub. Hand hygiene generally applies to routine hand washing using plain or antimicrobial soap, a hand rub using an alcohol-based antiseptic, or a surgical scrub using an antimicrobial soap. All of these can be used in addition to the alcohol-based hand scrub. Evidence supports appropriate and frequent hand washing as a primary measure for reducing the risk of transmissions. When you are dealing with a patient who has C. diff or VRE or MRSA, you need to make sure that you're using soap and water when you're performing your hand hygiene. Some of the bacteria that patients carry are spores, and the chemical within the soap is able to break down the spores, so that is going to reduce the risk of transmitting it to another patient. You can use the alcohol-based rub in between patient contacts, but if your hands are visibly soiled, you must use soap and water. When you enter a patient room, normally the foam or the alcohol-based antiseptic is located on the outside of the door. So it's always a good habit to use that as you're entering the room. You can talk to your patient, you can introduce yourself, kind of explain to them why you're in the room. Most hospitals nowadays have set up the room where there's an actual sink, so that after you enter the room and you've talked with your patient, then you can use soap and water to make sure that the patient sees you performing the hand hygiene. This is very crucial in building a trusting relationship with your patient. I want you to review the hand hygiene skill that goes along with your learning material. All healthcare providers must apply clean or sterile gloves, gowns, masks, respirators, and protective eyewear according to the risk of exposure to potentially infected materials. Gloves are worn for several different reasons. They are worn to protect the hands when the nurses are likely to come in contact with any bodily substances. They also reduce the likelihood of nurses transmitting their own microorganisms to individuals who are receiving care. For example, if a nurse has an open sore or a cut on their hand, the glove is going to provide protection. Lastly, gloves are worn to reduce the chance that the nurse's hands will transmit organisms from one patient to another. In all situations, nurses must change gloves between patient contacts. Nurses should clean their hands each time they remove their glove for two primary reasons. The gloves may have imperfections or may have been damaged during wearing, which would allow the microorganism entry, and the hands could become contaminated during the glove removal. A nurse can wear a clean or disposable gown. There are gowns that are water resistant, or the plastic aprons, and these are used during procedures where their uniforms are likely to become soiled. A sterile gown may be indicated when the nurse is performing procedures that require sterile technique, such as the changing of dressing with a patient with extensive wounds. Most gowns are a single-use technique, which means that the gown is only used once and then it is discarded. This is the usual practice in hospitals. After the gown is worn, the nurses discard them and place them in the proper receptacle. Before leaving the patient's room, the nurse must always clean their hands. The gown is donned prior to entering the patient's room to provide bedside care and removed at the conclusion of care. A face mask can be worn to reduce the risk of transmitting organisms by droplet contact and airborne routes, and by the risk of any splatters of any bodily fluids. The CDC recommends that masks be worn by the following individuals: if a patient is infected with measles, mumps, acute respiratory diseases that can be transmitted by large particle aerosols or droplets; all individuals that enter the room, if the infection exists, must be wearing a mask; all individuals that are capable of transmitting small particle aerosols, which are considered airborne because they can be suspended in the air and travel greater distances. This nurse must wear a special mask or a respirator, an N95 mask, because it provides a tighter seal around the face and a better filtration to be used in certain infections. As a student nurse, you will not be wearing a respirator because these must be fit tested, and the hospitals will not fit test a student. So if there are any rooms that are an airborne precaution, you will not be entering that room because you are not going to be properly protected, because you will not have the proper PPE of the N95 mask. Lastly, let's talk about eyewear. So there's different types of protective eyewear. There's goggles, glasses, or face shields. These are indicated when the nurse becomes enters a situation where they become exposed to bodily substances that might splatter into the face. If the nurse wears the proper protection, then this is going to reduce the risk of the bodily fluids entering the eye. If a nurse wears prescription eyeglasses, the goggles must be worn over the glasses to extend around the side of the glasses. Isolation attire refers to personal protective equipment, or PPE, that is required to protect each isolation type. PPE should be donned or applied and doffed or removed in specific sequences for best protection and prevention of contamination. So when you are donning your PPE, the first step is you want to place the gown. You want to make sure that you have a gown either that's going to tie. Some of the facilities have Velcro gowns, and then other ones have where the hole is cut in for the head, so then you just place it over your head. Make sure that you're going to, if you have a gown that is Velcro or it ties, that you're fastening this gown at the back of the neck and the waist. If it's not properly secured, when you're leaning over to perform whatever procedure, the gown is going to flop open and it will expose your uniform. The second step is to apply a mask or a respirator, depending on isolation type. So if your mask has ties, you want to make sure that you're going to secure the tie at the middle of the head and at the neck, or you can use the plastic or elastic ear loops and place those around each of the ears. There's also a flexible band for the nose bridge, so you want to make sure that you smooth that over so that you create that seal. The mask should fit snug to the face, and you want to make sure that you're pulling it below the chin. If you have the respirator, you need to make sure that you're wearing the proper size dependent on your fit check. So like I said before, as a student nurse, you're not properly fitted for an N95 respirator, so you will not be able to enter any airborne precaution rooms. The third step is you're going to place the goggle or the face shield over your face and eyes and adjust it to fit. And then lastly, you're going to don the gloves. When you're putting on your gloves, you want to make sure that you are extending it over the wrist of the isolation gown so that you do not have any exposed skin in the wrist area. In the last slide, we talked about donning the PPE and the proper sequence. While that is important, the doffing or the removing of the PPE is going to be extremely important to follow the sequence because of the risk of contamination. The first step is going to be to remove your gloves. So remember, the outside of your gloves are contaminated. You want to grasp the outside of the glove from one hand and touch the opposite hand and peel it off. So that way you're touching contaminated to contaminated. Once you remove that glove, you want to hold the glove that you removed in the opposite hand that has the glove still on. Then you want to take your finger of the ungloved hand and you want to go towards the wrist area and go inside so that you're touching the inside of the glove, which is not contaminated, and you're rolling the glove and peeling it off of the hand while you're folding it inside. So when you're removing the second glove, you should have both of the gloves in one hand. You're peeling it from the inside and rolling it into a ball. Then you're going to discard the gloves in the proper waste container. The second step is going to be to remove the goggles or the face shield if used. Remember that outside is contaminated, so you're not going to touch it from the front. In order to remove it, you want to grab the headband or the earpieces and remove it from the back, which is the less contaminated area. The same thing, you're going to discard this in the proper waste container. The next step is to remove the gown. So remember that front of the gown and the sleeves are all going to be contaminated. You want to unfasten your ties, or you can pull it to break the ties. You want to make sure that you pull away from the neck and the shoulders so that you're able to get on the inside of the gown, and the same as the glove. You're going to start at one of the shoulders and go under the gown on the inside, which is not contaminated, and peel off the gown. And as you're peeling it off, you're going to roll it into a ball So the gown's going to go inside out into a ball. You do not want to shake the gown because anything that's contaminated could possibly spread into the environment. So as you're rolling it into the ball, dispose of it in the waste container. The last step is to remove the mask or the respirator, and same thing. That front is going to be contaminated, so you're going to grab from the bottom, and then you're going to either untie it or remove the earpieces and discard in the waste container. Now that we have discussed the proper use of PPE, when do you use it? So your precautions should be designated for all patients in the hospital. So anytime you have the possibility of coming into contact with bodily fluids such as blood, excretions, secretions except for sweat, non-intact or broken skin, and mucous membranes, you should be wearing some sort of protective measures so that you can protect yourself when you come in contact with these bodily fluids. This is designed to reduce the risk of transmission of microorganisms from recognized and unrecognized sources. Making sure that you're performing proper hand hygiene after contact with these bodily fluids, whether or not you've worn gloves, is going to be crucial for protection and transmission. After you wear your gloves, you're always going to perform proper hand hygiene. You can use the alcohol rub or the non-antimicrobial product for routine hand cleansing, and then use whatever your hospital policy is if there's any sort of outbreak of infection. You do not need PPE every time you come in contact with a patient. It's when you have that risk of exposure to any bodily fluids is when you're going to don your PPE. So if you have any questions, make sure that you follow your agency's protocol for when you should use PPE. So now that we have discussed the theory behind performing hand hygiene and donning and doffing personal protective equipment, I want you to practice. So please review your skills related to hand hygiene and PPE, and we will be performing these in the lab portion of this course.